Thank you. So, Texas Health Presbyterian Hospital says it's taking steps to create a cohesive record-keeping system after it revealed an error on the records for Ebola patient Thomas Duncan. The hospital says Duncan was asked during his first visit if he had traveled out of the country recently. He said he'd been to Africa. The nurse apparently entered that information into the nurse's electronic records, but it didn't get put in the separate system for doctors. Presbyterian says it's now making changes to the record system so that they work together in the future. Investigators are now narrowing down who had casual indirect contact with the patient before he went to the hospital. That list stands at about 100 people right now. It includes 5 students in the Dallas ISD, 3 in the Richardson ISD, 1 in Plano ISD. One Dallas County official says Eric Duncan made contact with a big spider web of people who will be interviewed. Some will be monitored for 21 days to see if anyone needs medical care. David Daigle, the CDC Director of Communication, joins us live from Texas Health Presbyterian Hospital with more on that. Good morning to you, David. First of all, the number of people we know has been raised to about 100. So, yeah, at some point, obviously, these 100 people weren't visiting his home. Do we know, have you pinpointed what stores he went to, what errands he ran, and is that information going to be made public?
Oh, those are great questions, Lauren, and thank you for having me this morning. So I think the first thing we're talking about when we say a list of 100 is really potential or possible contacts. And so that list will be taken and we'll look for high risk and low risk, and then you'll have your final contact tracing list. And so this list will begin visiting these folks once a day and then calling them, and then we'll take their temperature and then we'll look for symptoms and interview them. So we will hope to have that final contact tracing list today.
As far as stores he visited, any errands he ran, are you going to make a list, release a list of possible places he was at?
No. What we're really looking for is people who might have had some sort of exposure to the patient when he was symptomatic. So if he was visiting the stores and he did have contact with people, then those people would be tracked and added to the list. But as far as, what stores did he go to, it's more important is, was he symptomatic at that time?
It sounds like a tough process. Duncan's family, we know, is being kept in their apartment. And this is the same apartment that he was sick inside. Is that safe to keep them in the place that he was sick?
And I know there's a lot of concerns about that. And we've had our team out there with the county folks as well. And I think we're comfortable right now, and I think there's some efforts going on to clean up the apartment and remove the linens, which will certainly help.
There's been a lot of talk about not allowing people in Ebola-stricken areas to travel into the U.S. You hate to think about the what-ifs. Is it at all possible that someone in Africa, maybe who has the money and thinks that they've been affected with Ebola, could just buy a ticket, come to the U.S., knowing if they show signs here that they're going to get top-notch care? Is that a fear at all?
Oh, it certainly is a fear. And with Ebola, it's very difficult because you can literally travel asymptomatic. So you can have the virus and then actually go through have your temperature taken, go through the screening, and still get to the U.S. without showing any symptoms. So it is very difficult and certainly a complex problem.
Are there any measures you think that need to be put in place to stop something like that from happening, or to limit travel from people who have been in those countries?
There's a lot of discussion about that. Right now, we have CDC folks working with Customs and Border Patrol at 20 different airports. And there are steps that we can do to elevate and warn people. And what we did during SARS is we handed out cards that said, if you've been to a country with SARS, here are the symptoms, please be aware of this. So there are things we can do, but you can't literally close the border and prevent the virus from coming to the States. That's impossible.
David Daigle, thank you so much for your update. We appreciate it.
Hi, thanks to you.